Dr. Reese. I am Andres Abrilla.
Hi Andres. I'm Jorge Say. Hi Jorge.
We would like to ask you some questions related to osteoporosis.
Yeah, of course. Yeah, go ahead.
Okay, doctor. So first question. What caused this disease?
Okay, Jorge, osteoporosis is caused due to the lost bone mass in your body. Your body is constantly replacing the bone tissue. However, when the lost tissue outpaces the new one, the bones become more brittle and with a higher tendency to break or fracture.
Could you explain how serious it is, or how could it affect the daily life of a patient?
It certainly depends on the lifestyle that the patient is used to. For a patient that is used to staying home and do little to no exercise, the most that this patient will experience is mild joint pains. But for a patient that is used to doing daily exercise, these mild joint pains could turn extremely painful and even cause an injury.
What is the short-term and the long-term prognosis for this disease?
Short-term could be joint pains and difficulty doing physical tasks, but this could evolve into more intense joint pains and even more difficulty doing simple tasks such as walking and running.
What was the chief complaint that the patient had for consulting?
Normally, patients who suffer from osteoporosis come here with severe joint and back pain.
What other symptom does the patient present?
Well, basically, it's their back and joint pains. However, other symptoms may be mild headaches and what patients describe as feeling weakness throughout all the body.
How can the patient be tested for this disease, and what does the test reveal?
To be sure of osteoporosis, what we doctors do is usually take a test of bone mineral density, mostly commonly known as BMD. In order to do this, we make an X-ray study in the patient in which we check their hip and their spine bone.
Yeah. What are the treatment options?
Treatment options depend on how severe the patient is. We recommend a healthy lifestyle before all. Doing exercise and having a diet based on receiving vitamin D and calcium are crucial to treat osteoporosis. However, medications such as alendronate, risendronate, ivandronate or solendronic are given to the patient.
What treatment is the patient receiving, and how effective is it?
Well, as I said before, having a good diet and doing exercise is very important to maintain the strength in the bones.
And what will happen if the patient doesn't get treated?
If the patient does not get treated or doesn't want to be treated, he may suffer from sting, hunchbacks, loss of bone tissue, fragile bones, and possibly death. Osteoporosis can cause you death.
What new technologies exist for preventing, diagnosing, or even treating this disease?
Well, before patients will only know that they had osteoporosis when the symptoms were at a critical level. But now, since the first mild back and joint pain, a person can get a quick X-ray with almost immediately results. This technology was only recently made affordable and available for people wanting these results.
Thank you so much, doctor.
Thank you, Jorge.
Thank you very much for having us.